Biotherapies are therapeutic molecules or cells or viruses that are actually produced from living tissues. And so they're very compatible with our bodies. Unlike chemotherapy, which is really chemicals that are used to try to poison particular kinds of tumors, for instance, or radiation therapy, which it comes from a radioactive source. These are therapies. Biotherapies are entities that come from our own bodies or from tissues from our own bodies that can be engineered to be highly selective. So whereas chemotherapy and radiation therapy, as we know, are associated with significant side effects because they attack both the cancer and they also damage normal tissues. In principle, biotherapies, because of the way they're engineered, are very selective. They really only attack the malignant tissues. And if anything, they actually have the ability to heal normal tissues and not damage them. So very safe, very selective, and hopefully much more effective than chemotherapy or radiation therapy. I've been a scientist with my own research group for in excess of 34 years now. And when we first started, I think the mainstay of therapy was chemotherapy and radiation therapy. And we didn't see a lot of improvement in patient outcomes. But within the advent of, let's say, the last 15, 20 years or so of biotherapeutics, we're starting to see huge changes in how patients can be treated and the outcomes they can expect. So in some kinds of very advanced forms of melanoma, for instance, patients who really had no chance to respond to standard chemotherapy and radiation therapy regimes, we're now seeing those patients have complete responses and apparently appear to be cured of their disease and have long-term remissions at least. So this is really, I think, a game-changing type of therapy that we'd always dreamed of and worked towards, but had not anticipated to be this significant in this time frame. Another version of this is the CAR T therapy that we talk about lots, chimeric antigen receptor T-cell therapy, which in the case of certain kinds of leukemia can really be life-saving. It can actually change the game for patients who really have no other options and take them from essentially death's door to having a complete response. One of the challenges of developing biotherapies from the ground up basically is having a way to produce them as a pharmaceutical grade product that you can inject into patients. And so at the Ottawa Hospital, we've been investing in what we call biomanufacturing or manufacturing of biological agents. These kinds of therapies, really, I think Ottawa is really at the forefront of the development of biotherapeutics